Hello everybody, hello Ricky and Christian.
Hi, Steen.
Welcome to the first Smart Education interview here in this cozy environment. We're very happy to have you both here as teachers from the DGSA, well experienced teachers who are been, I think it was more than 25 years already that you are teaching courses with your organization throughout the world. And we feel very lucky to have you here, and we want to grab the opportunity today, since you are teaching here together in Leuven with us, a course on dry needling. We wanted to grab that opportunity to ask you some questions about dry needling and those kind of things. So I hope I did introduce you enough. Otherwise, you can add something to that, maybe Christian, or
I'm fine with that.
Yeah.
Thanks, Steen.
for you too,
Also
Ricky?
for me that's fine. Nice to be here.
Yeah. I forgot to say that DGSA is home-based in Switzerland, and you both live there. But you also have teachers from other countries that come to Belgium and all over the world, who also are very good trained in teaching the dry needling by the DGSA guidelines. Yeah. Maybe my first question would be, maybe you can give us an idea about the most important characteristics of a good dry needling therapist. In other words, how can one recognize a proper trained dry needling therapist? What would be your answer?
Well, I think a good dry needling therapist always have to know where is the needle point within the body and be aware about the precautions in the region where he's treating.
Mm-hmm.
Yeah, absolutely, and anatomy. So, in our courses, we see a lot of different levels of anatomy skills, and in most cases, it corresponds with how precise a therapist can needle a specific muscle.
Mm-hmm.
So, I think the anatomy is essential, and secondary, I think the palpation skills.
Mm-hmm.
So, and if you ask what does a good dry needling therapist is, then I think it's when a therapist has the freedom to combine his good anatomy skills with his excellent palpation skills.
Mm-hmm. Mm-hmm.
I think
That's a good definition.
I think
Yeah.
that would be
And
a brief.
And of course, all the rest is
Answer.
experience.
Yes.
Of course, yeah.
If you add experience to that, if you have a good base to start on, with experience you come better, of course.
Yeah, and always to be flexible to adapt your techniques.
Mhm.
Yes.
Maybe a good example is this morning when we prepared for the course, as we do always for a course. Make a short briefing. What are you doing? What is my job in this today? We talked about one muscle,
Yeah.
flexor hallucis longus muscle,
Mhm.
just as an example. And again, we discussed what is the best approach. What are your latest experience about it? Is it better to pinch the muscle? Is it better to do a flat technique? What are the pros and cons? And so it's basically still, after 23, 25 years, it's still a constant process where we learn from each other, where we learn from other therapists, and also sometimes where we learn from participants.
Mm-hmm. Mm-hmm.
Sometimes a participant has an excellent idea and asks,
Yeah.
can I do this and this muscle in this position? And that's, yeah, it's actually a good idea.
Yeah. So always keep flexible, keep an open mind.
Right.
Yes.
Right.
For example, also since we use other devices like ultrasound devices, and we see, it actually looks not the same way like we expected.
Yeah.
And then that was one reason why we changed a lot of techniques, and we said, only superficial dry needling here, or together with a device
Mhm.
to control it, assist it with an ultrasound device, for example.
Yeah. Okay.
Mhm.
Very good. So, as I said, you've been teaching around the world, and now we work together for almost 2 years now. How are your experience so far here in Belgium? I mean, with the Belgian physios, teaching for Belgian physios. Can you compare it to teaching in other countries? And actually what I wanted to know is, what is your idea on the level of knowledge on the one hand, and quality of therapeutic skills of the Belgian physios in general?
Well, first I would say...
There's only one good answer.
Yes, the Belgian physiotherapists here are very smart, educated.
Okay, yeah, that's a good one.
Yeah, no, I think they have quite good therapeutic skills, good anatomic knowledge, and are very interested.
Yeah,
Discipline,
Discipline also, yes. Yeah,
good.
on time.
Mm-hmm.
yeah
And
very
I think,
Swiss.
yeah, I think
The
the-
Swiss life,
Very
has to be
Swiss-like,
on time.
yes.
Absolutely.
Yeah.
And I think the level is over the average.
Okay,
Over the average.
that's also good to hear.
Yeah.
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 And then you bring them to an even higher level.
I mean, of course, in dry needling.
Yeah.
And
Yes.
I think what I'm talking about when I talk about the level is the level of anatomy skills and also the level of physiodiagnostic knowledge. So I think they know quite a lot about.
Yeah. Which is good to hear. Which
yeah.
is good to hear.
Yes.
Yeah.
No, we are happy with the people.
Okay,
yeah.
very good.
Yeah.
Maybe now we can explore or go into some other things like research, which is important. And I wanted to know from you guys, what does the latest research tell us about the value that dry needling techniques can give us as a therapist while we treat patients with myofascial pain and trigger points or pathologies with a myofascial component in it. And more exactly, how should we implement dry needling in a well-based therapy program? Maybe those are two different questions. So how about the latest research and what it can help us while treating? And on the other hand, how can we implement those skills as part of a good therapy program?
Right. Maybe I can answer this question. I think when I compare the amount of studies that come out nowadays in the last years,
Mm-hmm.
it's amazing. It's basically exploding.
Mhm.
So there are many research
Mm-hmm.
in dry needling, in the field of dry needling, and of course also in outcome studies. So many outcome studies and also meta-analysis says or show that dry needling has a positive and a very good effect in, for example, low back pain, shoulder pain, elbow pain. And so it seems that most of the studies that are out now show a positive effect.
Mm-hmm.
However, most of these studies also say in the conclusion further studies are needed,
Further research. Yeah.
further research is needed, and the problem is that often the N is just low. There are maybe
Yeah.
20, 30, 40 people in the
Yeah.
study. So I
So
think
the study design is sometimes.
sometimes maybe not strong enough.
Yeah.
So that's maybe for the first bit. So there are many studies that show dry needling is an effective tool in the treatment of myofascial pain.
Mm-hmm.
And maybe the second question was how to implement it in a good treatment plan. I think then we talk about trigger points.
Yeah.
And we have to keep in mind that dry needling is not the only tool to treat trigger
That's
points.
important. Yeah.
There is also manual trigger point therapy,
Mhm.
there's shockwave,
Mm-hmm.
maybe ultrasounds,
Mhm.
maybe exercises as well.
Education. not to
Education
forget.
as well.
Yeah.
And I think a very important point is that it's also, there is a reason why a person or a patient has trigger points. So of course, we have, as a good physiotherapist, we have to find out why does the patient always develop trigger points in that area?
Yeah.
Is it a certain
To see the bigger
movement,
picture, to the.
repetitive strain injury, etc.
Yeah. Yeah. Yeah.
And maybe one thing which is quite important for me is that dry needling has become popular, and I think that's a great thing. But actually, Ricky and I, we come from manual trigger point therapy. This is basically our home treatment, and dry needling developed out of the need that we treat the trigger points, and we thought there must be something more specific, more precise.
Mm-hmm.
And then we developed actually this technique and make it better and better. But we still use a lot of manual facial techniques
Yeah.
to treat myofascial pain. I think this is
Yeah, I think we started with the interface of the trigger point. We treat it more or less with our hands around the trigger point to really go exactly into a trigger point. If it's deep in the muscle, that's difficult with our hands, and that was the need. We have to go into it. We pressed harder, and finally we took a needle. I think now it's just the opposite side. People start to treat all the trigger points and waiting for miracles. Sometimes you have a miracle, but very often you have to treat the point, but the point is only a point or a complex, and you have to really go to the interface, to the muscle, to the fascia, to the whole chain you have, and then and actually in our daily work we have to look at the patient, and it is just a part of the problem of the patient.
So facial release is a very important
Yes,
thing.
very important. And also functional knowledge. So it's not only myofascial pain, it's also myofascial dysfunction. So you can implement it also in other manual therapy techniques, and actually it changes always how important is trigger point therapy in a disease, in a dysfunction of a joint or whatever.
Yeah, very well said. I totally agree, and I've my own experience. I always start with manual trigger point techniques, and then I noticed that if you use a dry needle, if you use the needle techniques, you get better results because the problem was deeper, and it's sometimes difficult to get in depth with the manual techniques. I think it adds something to a technique or a therapeutic skill you already developed.
If you recognize the perpetuated factors, or perpetuating factors,
Okay.
Yeah. One last thing to that. I think
Yeah.
it's important. If you do dry needling, end the treatment with some manual techniques. And if it's only 1 or 2 minutes, not just take the needle out and then that's it.
Yeah, you can go home
Think
now.
about the fascia.
Yeah. Okay, very good. We talked about studies that show positive results with dry needling, but there are also studies lately that really question the use of dry needling when there is no significant difference when compared to other interventions like we discussed, education and exercise. But on the other hand, just like I said, we do experience positive effects with our patients in the daily practice. Do you know what are we, and maybe also the researchers, what are we missing there? Or is that a difficult question?
No, it's not. Yeah, maybe.
Maybe a difficult answer.
It's I would say, first thing is, dry needling, the indication for dry needling has to be given, it has to be clear. So we have to have a specific point, and that's the first thing. I mean, often dry needling is done with patients where the indication is not really given. Okay, that's one thing. And the other thing, and that's maybe the difficult part of the answer, is that not all dry needling therapists apply dry needling correctly. It starts with the diagnostic criteria. It's very important that we think about taut band, tenderness within the taut band, local twitch and referred pain, and that we have excellent palpation skills are the precondition to find the trigger points, and then of course the correct treatment of dry needling, which is not. If I read some studies, sometimes I question the diagnostic criteria, and I wonder how have they really applied dry needling?
Yeah. So that what you're saying is there is a lot.
Explanation.
There is a lot of interference sometimes. That there is a lot of parameters that are maybe not well standardized.
Absolutely. The doses of the treatment. The way you treat it, is it dynamic, static, superficial?
So it's difficult to make a standardization.
Yeah, and really, I mean, it's not easy to find a trigger point or to hit the right trigger point in gluteus medius minimus. Often therapists, they only needle maybe 1 or 2 points in the gluteus medius, but it's a huge muscle. So often it's undertreated, sometimes it's overtreated. So I think this is could be part of the explanation.
Yeah, yeah. Actually,
Yes.
that was not that difficult.
No, not really. And I think if you, for the diagnostic criteria, maybe also to diagnose the trigger points, it very often helps also to have like first a pre-treatment, manual pre-treatment, just to have to really have the right position of the trigger points. It's actually what you say. Either you just look for trigger points in the gluteus, or you look especially for the right trigger point, and it's recognition of the pain, of course, and sometimes it's also again a dysfunction. So you're during a movement, you have a pain. Sometimes the pain is not a referred pain; it's just a pain because of the shortened muscle. And then, if you don't differentiate this matter, you probably will fail with the study too.
Yeah, yeah.
This goes direction latent trigger point, active trigger point.
Yes,
Yeah.
exactly.
Okay.
And that's something we include in our treatments. And I think that's not really, mostly not part in many treatments that you differentiate this.
Or in the research,
Mhm.
yeah, the differentiation. Okay, yeah, it's been very interesting but brief, but we wanted to keep it short. Maybe one
We
last
were too
thing.
long, I think.
The DGSA program of courses that we deliver to become also a certified dry needling specialist, it consists of the top 30 muscles, followed by 2 advanced courses. And when participants have done that, they can go to a exam preparation course, and finally the exam. And we're happy to announce now that in June 2019, so within a few months, we will organize this exam for the first time in Belgium. And with Ricky. He will be the examinator. Yeah. And we look very much looking forward to that. So in a short time from now, there will be the first DGSA dry needling specialist here in Belgium. But I was just wondering, how many of dry needling DGSA therapists are there already certified worldwide now? Do you have an exact idea on that?
Not exact,
No.
but we have, I would say, around 800.
800.
Yeah.
Okay.
Yeah.
Yeah. Mostly in Europe,
Yeah.
Yes.
Switzerland.
Switzerland, France.
Yeah.
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 Yes, because in some countries like France or Switzerland, it's not the DGSA that takes the exam.
Yeah.
We have an association,
Okay.
and so also in Switzerland, from other organizations, they can come to the association and make the certificate.
But it's the
So
same education.
it's-
It's a
yes.
DGSA education, and
Mhm.
the examination board is, for example, in France,
Okay.
it's
Yeah.
not the DGSA.
Yeah.
So almost 1,000 then.
Yes, almost
We will try to help you to get to that.
over
Yeah.
that point.
That's
that
great.
point. Okay, thank you very much for this cozy talk we had. I
You're
think
very
it's
welcome.
time now to grab something to eat, and then to have a Belgian beer, of course.
Oh yes.
Did you bring your Swiss chocolate this time?
Not this time.
Oh.
I'm so
So we
sorry.
can't have a competition this time.
Praline or chocolate? That's the big question.
That's the big existential question in life. Yeah. Okay. Thank
Thanks
you
a
very
lot.
much,
Thanks.
and
Thank you.
we'll see you tomorrow here
See
with
you.
us. And then thank you for being here.
Yeah, thank you for the
Thank you.
invitation.
Thanks.